Last night on Checkpoint, we covered the review of the urology department at Dunedin Hospital. The review said long waiting patients had, quote, a significant level of clinical risk and that, again, a quote, serious clinical events have already occurred. Now, we know some of those serious clinical events are related to delayed treatment. We're trying to get specific details. Gary Brodie went to his Dunedin GP in September of last year after his brother was diagnosed with prostate cancer. He had no symptoms, but he wanted to get checked just to be safe. His PSA blood test result was 18. He retested 3 weeks later. It was 20.
I rang up the hospital in early December to see about when I was going to get a biopsy, and they booked me in on the 20th. And then on the 17th of January, I got my results. And with the prostate, they divide into 6 parts. And with the biopsy, I had it in 3 parts. And a week later, the anaesthetist and ECG, on the 26th of January, I went in for an appointment. And he's just asking all the questions and that. And he said, I'll see you in about a fortnight for your operation, you know.
So you had cancer, prostate cancer,
Yep.
and so far so good. Everything was going very smoothly. You'd even seen the anaesthetist, and you were booked in for an operation at some stage in February?
In February, on the 26th of January, the anaesthetist said, I'll see you in a couple of weeks' time.
Right, and what happened then?
On the 16th of March, I rang the hospital to see how is it going, because, you know, you've 2 weeks, you know, I haven't heard anything. Just wonder if the letters got missed in the post and that. And I got the woman that I saw at the biopsy, the results, and she said, you're 7th in line. We've got no theatre time left. It'll be later on in the year. And I was bloody worried as hell. You know, she at first when I had the results, she said, "Give me a ring anytime. Anytime, I'm here to talk things over." And when I rang her, you know, she didn't really want to know me. So the wife rang her about 2 weeks later after that, on the 23rd of March, and she was told that things had fallen through, that they had no theatre time.
At all? No theatre time at all, full stop?
No, full stop.
So wait a sec.
So,
I just need to explicitly clarify this. You had been diagnosed with cancer, and you were told initially by the hospital that you were going to get surgery almost immediately.
Yep.
And then you waited and waited, and after a period of weeks, you were told there was no time for you at all in theatre.
Yeah, in theatre. They had no theatre time.
Then what happened?
Then the wife got in contact with my doctor to see if we could go private, and he got on the case straight away. Rang up Southern Hospital in Christchurch, and I was booked in for a fortnight after that. I had to pay for it all myself, which came to a sum of just on $37,000.
And
at that stage,
and fortunately, you were in the position to be able to do that, right? Because
I did. I had insurance, health insurance, but about June last year, I decided not to do it because it was costing us $300 a month. So I cancelled it. Silly thing, you know. In hindsight, I wish I still had it, but you know, it's one of them things.
So if you hadn't had that operation, would you still be waiting now, as far as you are aware, with prostate cancer for a response from the public hospital in Dunedin?
I've rung the Dunedin Public Hospital 3 times because I've had different appointments. One for, they rang up and said you were, early July, they said your prostate surgery is coming up. And I said, have you got a time, any dates? And, you know, and they said, no, we haven't. I can't give you a date. And I said, oh, that's okay, because I had it out in 31st of March. Oh, we didn't know that. I said, well, you must have, because all my records went to Southern Cross from Dunedin Hospital. Then 2.5 weeks ago in the post, I received an appointment for my MRI for my prostate operation, and that's for on the 23rd of August. So I've been waiting since January to now to the 23rd for an MRI, and they still, they hadn't taken me off the list, so just shows you what's happening down here.
So you were diagnosed, your biopsy was on the 20th of December, you are going to get an MRI in August, and there is still no surgery date.
No.
And all of this is taking place incredibly slowly after you've had the surgery in private because you were able to pay for it.
Yeah, that's right.
And the hospital hasn't even registered the fact that, despite them providing your notes to the private hospital, that you've gone elsewhere.
Yeah, gone elsewhere. Yeah.
So what does this say about that department to you?
Well, I honestly don't know. One thing I'm pleased about is I don't really need the MRI now, so I've made it for someone else to have my place, which hopefully something's good come out of that,
If you hadn't had the money, and lots of people don't have, $37,000, how old are you?
No. I'm 63,
Yeah, right. So you're approaching retirement, right? And so you need the money to touch wood, grow old with. So lots of people, if you hadn't had the money, what do you think would have happened to you?
Well, I'd say I'd be gone within 5 years. I said to my doctor, I said, this is after the operation. I told him what would have happened to me, and he says, well, you wouldn't be here, Gary, in 5 years,
Your GP said that, or your surgeon?
Yeah.
Your GP?
No, my GP, yeah. And they said to me at first, the biopsy, it's only a slow-growing cancer, so don't worry about it. Well, I had it in 3 parts. That was in January. And on the operation on the 31st of March, it was just getting into the 5th part of my prostate. They divided it into 6. And so, if anyone says it's a slow growing, I wouldn't listen to them.
So it was moving through your prostate while you were waiting.
Yeah.
And you had diagnosis, you had biopsy, they had your notes, the anaesthetist had spoken to you, they knew that you had cancer, and you couldn't get a date in surgery and theatre.
No, definitely not. With the weight, it felt as though I had a death sentence hanging over my head.
Did it?
Yeah, it really did.
And what do you say now to people who are, and since we've started covering the story, it appears that the waiting list has fallen from 11 to 5, so 11 down to 5.
Yeah, I just wonder if I'm number 5.
What do you say to the people who are in the 5?
Oh, I just feel sorry for them. If they mucked me around, it can happen to anyone.
You paid your taxes? You worked all your life and paid your taxes?
Yeah, paid my taxes all my life, and you think you come to a time that when you need a handout, and it's not there for you.
Well, public care, it's public health, isn't it?
Yeah, public health.
And it wasn't there for you, and had you not been able to go private, you would be about to have your MRI.
Yeah, yes.
Are you upset about this?
I am. It makes me bloody wild.
And what are you most upset about? What is it that makes you bloody wild?
Oh, I don't know. I expected better, It's not the money side of things. I'm here, aren't I? So, whereas a lot of other people can't be because of money.
You got a message for the hospital, for the Southern DHB and the bosses there?
Oh, get it right. Because a lot of people's lives are at stake.
It's Gary Brodie, whose cancer spread while he waited for surgery.